The black community and mental health. The word crazy. Let's try not to use words like that. Sometimes even myself, I use it tongue in cheek, not really meaning literal, but we'll say he or she is just crazy. When in fact, there's actually some underlying issues going there, some healing that needs to take place. Or they could actually have a condition that is causing them to act a certain way. So the word crazy probably is something we should not use in terms of mental health. Now that we have the information and understand that there are many different types of conditions and causes to the behaviors that we have. Let's not normalize dysfunctional behavior. Like sometimes we'll even say he or she has an attitude problem, or he's just an angry person, and we normalize it and we accept it, when in fact there's some healing that needs to take place. So things that we accept day to day and have accepted day to day in the past, I think that we need to address them and treat them as such, as unhealed traumas, and do not normalize dysfunctional behavior. Let's keep an open mind when it comes to mental health. Let's understand that we come from, us a lot of times in our community, we come from a style of parenting where we throw things under the rug, and our grandparents, and we don't quite understand the impact, how things and events that have taken place can affect us long term. So let's keep an open mind and not criticize others when they want to seek help. Also, in the black community, we should understand that licensed mental health professionals, therapists, social workers, clinical social workers are not the same as child protective services or DYFS, whatever you want to call it by the old name. Sometimes the services go hand in hand, but when you're proactively trying to seek help, one is not necessarily the same as the other. They don't always go hand in hand in every situation. So I do understand that where we come from, the trust between us and that side of the fence is not always there and the greatest, understandably, because of how things systemically have been. But therapists, we don't ever want people in our business, but they are not the same. Success cannot heal trauma. Like I said previously, a lot of us come from marginalized communities where we had to work for everything. A lot of us, our mothers and fathers didn't have much, so we'll hustle our way. We want degrees, we're coming up in the world. We want businesses, which everything that I'm for, I'm fine with that. I co-sign that. But we have to understand that all of these achievements cannot heal the underlying trauma. It actually can just magnify it in ways, because the more successful you become, you start to believe that the trauma is no longer there. And at some point it'll catch up to you. I know personally. So remember, success cannot heal trauma. Let's do the work.